All righty, well, let's get started, everyone. Welcome to the third Fireside Chat of the summer. We've been keeping you up to date as conditions have developed across the state of New Hampshire and across Massachusetts. Certainly the theme of this year is and will continue being fluidity. And that will not be hard for Derryfield folks because we are certainly a nimble school, certainly a school that has a growth mindset, that it teaches students to be entrepreneurial, to think in an innovative way, to be problem solvers. And that's certainly what we will be modeling this year as we have been. We certainly will continue to keep reviewing as new information emerges, and we will adapt our guidelines to suit those changes. And again, what a good lesson in life for our students. This year, we are again grateful that we are a New England school, and we're especially glad to be in our region in light of the fact that the pandemic's nature has shifted and is in large part due to both vaccines and the Delta variant. And we really envision our guidelines for Derryfield School in light of the reality on the ground in the 54 towns and cities and locations where our students come from. So we really see it through that lens. We will also be coordinating with state guidelines, and those have also shifted as the nature of the pandemic has shifted in our region. So I want to welcome again my wonderful colleague and now friend, Mike Klingshirn, who's been on this very long pandemic journey. Mike, welcome.
Thank you.
Thanks so much for being here, Mike. Mike, my friend Sarah told me she's thinking about this phase of the pandemic as though we're in the last quarter of an action movie. And the big alien spaceship was blown up, but then, you know, that you think it's over, and then there's a resurgence of a smaller alien spaceship, and we got to knock that one out of the sky, and then we'll have the happy ending. How do you feel?
Then we hopefully get that ending.
Excellent. Well, I hope maybe the Air Force can help you feel like you can relate to that idea. So Mike is an award-winning Air Force public health officer, and he has over 10 years of experience in leading teams and devising strategies, overseeing operations that have to do with health and safety, and particularly around infectious disease control, which is really suited for this situation. He has a certification in public health as well as a PMP, and his educational background is in pharmaceutical sciences, his undergraduate degree, and a graduate certificate in biostatistics and a master's in public health in epidemiology. Early in his Air Force career, Mike was tasked with developing base level disease containment plans. So that's working to manage individual military bases. And his doctrine was used as a template across the Air Force. It's also worth noting that Mike, his wife and his two children moved to Florida last year as part of their family's continued Air Force service. And his closest fusion cell colleague, Jimmy, who's worked with us before, lives in Texas. So together they have a real different kind of perspective on this pandemic, as they both live in the Deep South, where the COVID rates are the highest in the US. And they bring that perspective to their work, seeing Derryfield within a larger geographical context. Mike, I wonder if you could share with us who else is on your team.
Absolutely. Well, you hit the most important person, Jimmy. Jimmy Adelani and I came into the Air Force at the same time. We went through the same commissioned officer training at the same time in the same class. So we have been together since the beginning. We've done our Air Force Public Health Officer School together and all the extra trainings that come along with the job. So we've been side by side forever. Just like me, she holds a master's in public health with a concentration in epidemiology. She will tell you that she is smarter than me because she is. She got out of active duty Air Force about a year before I did, and she joined the Texas Air National Guard. I followed suit. I joined the South Carolina Air National Guard, and it's been the best career decision of my life. I get a lot more time with my family and a lot fewer all expenses paid vacations to the Middle East. But we have
I was going to ask you about some of the other folks on the team as well.
Absolutely. So another big contributor to a lot of our projects has been Dr. Walter. He goes by Sparky Matthews. That's his call sign. He was an Air Force flight surgeon, and then he transferred over to the Space Force. He retired as a 06 full bird colonel out of the Space Force. And he was one of the first surgeon generals of the Space Force. So he was the first senior flight doc to transition over to the Space Force. He was my first boss when I got into the Air Force. And we have remained good friends since then. And now he's on the team and he contributes quite a bit. He's got board certifications in PrevMed and also aerospace medicine. And right now he's teaching at the Baylor School of Medicine over in Texas. So he's living the Texas dream as well. Another person that we just recently brought on is Dr. Dan Foster. He's a Navy flight surgeon. He outranks me and he's definitely smarter than me in a lot of ways. But he's running the COVID program, the COVID vaccination program for all of the Marines out in Hawaii. And so trying to get young, very near focused individuals to think long-term about their health has been a challenge. And he's doing some pretty awesome things in a population that's very resistant to vaccination. So he's fighting the good fight out there. He's got a board certification in PrevMed, and he's going to be sitting for his occupational and environmental health board certification later this year. And then another major contributor is soon to be Dr. Tomas Viteman. He's out at Tyndall Air Force Base. He's a public health officer like me, but he started off in the Navy, got his environmental health and industrial hygiene master's, and now he's going for a doctor of public health and epidemiology at the University of South Florida. So go Bulls, that's a big plug. I'm also a USF grad. So if you get a chance to go to Tampa and look at a college, I highly encourage you to look at USF. But he is doing public health emergency officer stuff at a base that pulls in almost all of the people that are deploying with fighter squadrons. So we have a lot of influx of individuals, and he has to mitigate COVID as best he can with individuals that are coming from all over the globe. And so it's pretty challenging, and he keeps that strategic focus with the ability to move to the tactical level. And he's been doing some pretty good things out there. So it's been great having these folks on our team because we all kind of have a different perspective being, stationed all around the world, seeing things with different lenses. And it's not just one epidemiologist saying this, it's, hey, what do you think about this? And so we have a lot of cross communication as well.
Mike, can you talk a little bit about your process and how you and your Fusion Cell colleagues come to your recommendations?
Absolutely. So our biggest person that we look at first is always going to be the Centers for Disease Control. And we look at them because they make some pretty big decisions, but they're not the only place we look for information, because you got to remember that the CDC has to make broad stroke recommendations to help schools in New England that are doing really well as help schools in Missouri and Louisiana where they're not doing so well. And so a lot of these recommendations are exactly that. They're things for schools to consider. They're things for states to consider as they transition through this intra-pandemic phase. So once we digest what the CDC has said, and we figure out the rationale behind a lot of their different recommendations, we then go to the state level. So we start to hone down and narrow that focus. And we listen to what the state folks are doing. We sometimes call them and talk to them about their rationale for different decisions. Sometimes we're successful at changing things. Sometimes it's just little minor issues like trying to get them to correctly publish data on their website, like the state of New Hampshire. And we talked about this earlier today, where they're publishing raw data and calling it a rate. But once we go from the state, then we look at what's going on in the community. So then we start pulling data around COVID transmission, community-based transmission within the areas around a school, within the state itself, and then in the states surrounding it. And that way we can get a bigger picture view of what's happening in the COVID world, not just what's the direction in the academic world. As we're doing all this in our free time, sometimes we get overwhelmed with a vast amount of publications, whether it's coming from peer-reviewed journals that just got published, if it's preprint studies, if it's stuff that gets sent our way from anybody. And we have schools that'll send us a paper that was sent over by a parent, and we'll review it and give them a critical in-depth look at what do the numbers say, what's the message. And we will look at everything. There's nothing that's off the table. If it's a study, if it's done by a credible source, it's going to be in our brain and we're going to discuss it. And sometimes those studies get redacted, and that's part of the scientific process. Is as we learn more, we want to make sure that the most current, most up-to-date information is being published. And so we still read them, and we figure out where we have come from and what's changed in our thinking, and how do we apply that to today's situation.
You're describing really the way that scientific knowledge and research develops, aren't you, Mike? That it's not always a straight line of knowledge. It's new knowledge, better studies as replace what was known before. And that's part of the experience as our advanced science students understand.
Absolutely. We never say the science is true. We just say we failed to disprove a hypothesis. Mm-hmm. And that leaves it open because you either disprove it and you move on to a better hypothesis, or it holds true with today's science.
Excellent. So we thought we'd start with just giving everyone a moment to read sort of our guiding philosophy here at this point. And now one more page to read. And we will take questions at the end. And sorry, I forgot to mention it was on the first slide. If you could send your questions to communications with an S, communications@derryfield.org. Great. So I asked Mike to just start by sharing with us a little bit about how to think about numbers related to the pandemic. Mike?
Absolutely. So numbers give us a very rational way to determine what needs to happen. They tell us what's going on with COVID in the community. And they provide, if you use them correctly and you break them down, not just from raw numbers, but into rates, they provide you a way to compare things across different states and different areas and even different countries. And so, for example, when we're talking about today's case rates, we look at the 14-day average that's published on the New Hampshire COVID dashboard. And they actually don't have it listed as a rate. They have it listed as a raw number of 208.7. But when you take that and you turn it into a rate, you find that rate's, when you adjust for population size, that rate is around 15 to 16 new cases per 100,000 as your average over the last 14 days.
So when you per 100,000 people, right? So
100,000 population in the state, yes.
Because what we're trying to do is understand what is that 208, I think you said, cases mean in a state of 1.4 million people versus
Absolutely.
Somewhere a larger state. Thanks.
And so rates are great because, like I said, you can compare what goes on, but you can drive decision-based metrics off of rates. It's hard to do with raw numbers. Because if you had 208 cases in New Hampshire, you might be in a light colored green for risk of transmission. If you were in a bigger state like California or Florida and you saw 208 as your 14-day average, you would be ecstatic. That would make you, because of your population, because of your denominator, in the green tier. You would absolutely be under 5 cases per 100,000 people. And so rates give you a defined way to look at what's happening. And as rates go up, you can adjust course. And as rates go down, you can take back some of those protective layers. But some of the other things that we look at, and first and foremost, and I have to say thank you to all the faculty, to the staff, to parents, because the vaccination rate at Derryfield School is absolutely exceptional. We're talking above 87% for the student body. We're talking above 95% for the staff and faculty. And so when you take those numbers and you compare them to New Hampshire, you're well above average. And then when you take New Hampshire and compare it to the United States, you're still above average. So you are in a microcosm of high vaccine adoption, which is not seen throughout the United States. And I live in Florida. I can attest to this. Vaccines absolutely save lives. In my little community here, the hospital associations published data of how many inpatient people are there, and they publish stats on vaccination. And right now, our current hospital just down the road has 68 people in there that are hospitalized with COVID infections. 3 of those people are fully vaccinated, the rest are not. So when you look at the risk reduction that comes with vaccines, it plays a huge role in buffering the effect of COVID, especially within a school. And so that's why we can be a little less conservative and use the upper limits of these numbers as our driving guidelines for deciding when to add a layer, or use the lower numbers when deciding to take a layer away.
Mike, just to clarify, which point indicator are we in right now with our new cases per 100,000 people?
Absolutely. You're between the dark green and the yellow. So you're light green.
Light green.
So the current rates in New Hampshire for 14 days are right around 17 to 18. So you're at the upper limit of green, but you're definitely not in yellow quite yet.
Thanks.
Things that are not going to change this year. If you are sick, please stay home. We learned this last year, and we had very great success at Derryfield School with just a few positive tests and 0 cases of in-school transmission. So the idea of staying home when you're ill and just seeing a doctor, getting evaluated, getting checked out, and potentially even getting a COVID test, it safeguards the community as a whole. When you start doing those daily attestations in Magnus, when you continue doing those, because you did them last year, it gives you more attention to what's going on with the individual health status. So if something does change, you don't just kind of write it off as, oh, it's the sniffles. Then it's, oh shoot, you were good yesterday, you have the sniffles, it's not allergy season. Maybe I'll make an appointment real quick and just get you checked out. Because it's not just COVID that's going around. In the younger populations, we're seeing RSV. There's a whole bunch of diseases that are still there, but we're very focused on COVID. So it's always good to see a doc and just make sure it's not something else. Communication around exposures is absolutely going to happen. So if there's a COVID positive person within the school, you will get a notification. And if your student is around that, the contact tracing is going to be done by Lainey, Nurse Shaughnessy, and that communication will absolutely come out to you. She's going to be working with the local health department and making sure that all of those exposures that potentially happen are properly documented and that the local health department has visibility on it as well. Nothing's going to change in the daily disinfection of facilities. What we saw last year with COVID, the CDC put out a pretty robust study of what's the risk of touching something that's contaminated and then somehow getting COVID, and that's your only route of exposure. And that risk, as they defined it, is about 1 in 10,000. So we have not seen significant rates of transmission from contaminated surfaces. We're still cleaning them, we're still disinfecting, but we don't need to be as hard up on cleaning and disinfecting those items. And you'll see some things coming back. So shared items will definitely be a consideration for this year. The indoor air quality. So there's going to be no adjustments to the HVAC system, to the upgraded MERV filters within the spaces, to the HEPA filters that are going to be providing extra air changes within the rooms. None of that's going to change. So we're keeping it static because it worked. It was those layers that we saw last year that worked. Food will be plated. It'll be served. It won't be self-serve, but it will still be a nice hot meal. It'll be kids in a dining hall, and they will be able to eat and socialize like they used to. Please keep washing your hands. Soap and water has done more to extend the life expectancy of the human race than all of medicine combined. So please, please, please wash your hands. You don't want to get colds. You don't want to get flu, especially when we're so focused on COVID. It can lead to extra tests, and sometimes those are uncomfortable. Universal masking. So we're not expecting to mask everybody right now. We had that broad stroke last year. What we're looking to do is take a more surgical approach to it and find out where people are closest, because it's that close contact that's going to make or break a masking situation. And so if you're going to be sitting at a desk, it's going to be mask optional for the vaccine eligible students. If you are sitting at a desk in 6th grade, it will be a mask requirement. So the idea is still, because they haven't had the chance to make a choice, because the vaccine is not available for their age group, we want to make sure that we're protecting them as much as possible. Places where you will see masks are robotics labs when you're close to somebody, as you're transitioning through the hallways, just because of the vast amount of students that can be in a hallway at one time, that shoulder to shoulder interaction, and a few other places.
And I'll talk more about that, Mike, in a little bit. I wonder, Mike, could you explain why outdoors now the science seems to support not wearing masks and not worrying as much about the distancing? Last year, we were very careful and strict with masks and distancing outdoors and cohorts, but what has changed in the science?
Yeah, so we have had a lot of time to evaluate the risk, a lot of time to see what happens in school, to see what happens during sports, to see what sports are higher risk of COVID infection. And taking sports as an example, because sports are typically where you're going to have a lot of close contact. Not that you won't on a playground, but sports are pretty darn intense because you're actively trying to win a game and you're really giving it your all. So the tendency is to breathe harder, to get closer, to be a little more aggressive. And what we saw is that being outside with the amount of fresh air that's available, it is a huge risk reduction. Outdoor air is vastly safer than indoor air. And when we talk about indoor air, once again, it's that indoor air quality that was adjusted last year and is not changing this year. So better air changes, the filtration that's capable of handling aerosols, and also air purification within the rooms.
And we're so fortunate with our new facilities in our athletic and wellness center and our Science and Innovation Center. And then actually also our auditorium has such a vast quantity of air and a new HVAC system. So we're so fortunate in that sense. So moving on, not forwarding here. Let's talk a little bit about how we're thinking about the health guidelines. So we're considering health guidelines that are important to diminish the spread of the virus, and we're considering the one also which ones had a negative effect on learning and on the student experience. And so our protection strategy moving forward holds both health and learning in mind at the same time as we think about it. So what we're planning for the 2021-22 school year, sorry, we're having a little frozen slide situation. Maybe my friend will help. As Mike intimated, for the 6th graders, who are mask ineligible. Oops, let's stop that for a sec. We'll stop it for a sec. They will be universally masked indoors at all times. So 6th graders can't be vaccinated because there isn't a vaccine yet available for those young ones. And they will also be separated from older students, except for really specific, again, programmatic purposes or truly practical purposes, like they're in chorus together, they're in exploration courses with seventh graders or eighth graders, or they need the bus and van transportation, they would be masked together on that, or they're on athletic teams as well. So the sixth graders are in their own category. Hopefully the sixth grade graders will soon have a vaccine available to them. And when an amount of time has passed that the sixth graders would have the opportunity to be vaccinated, then we will move them and treat them like the older kids, who I'll talk about in a minute. Still, the sixth grade experience is going to be better than last year because the science, as we've mentioned, supports these adaptations. It allows for students to share materials and work closely for short periods of time on labs, on robots, in group work. We will mix all the sixth graders as we did at the end of last year. There won't be separated cohorts of, say, 14 students in a group within the sixth grade class. All the sixth graders are going to be mixed and mingled so that they can make friends with each other and have that social interaction. Outdoors, masks are optional. And in addition, students may choose their own 2-ply or 3-ply masks. Hopefully they'll pick some that feel comfortable for them and fit their faces well. That being said, we actually have a Derryfield mask, enough to give every student in the school one to start the year. And then we have been fortunate in that we now have enough of the light white disposable surgical masks that we actually have enough that every student could have a new mask every day of the school year. So no worries if you forget a mask this year, we'll have plenty to hand out at the door. Or if you need masks, we can help provide those for you. So as we said, the sixth grade, the situation is fluid. Interestingly, and Mike is the one who kind of explained this to me, that because the older students in the school have such a high vaccination rate, the sixth graders are actually protected by being in a universe of highly vaccinated people. So in other words, it's probably safer for sixth graders to be at school than it is for them to be in public places where you don't know what the vaccination rates are. So that's something to think about. Mike, you were going to comment just about COVID in general in the community, the Derryfield community.
I was on mute. I apologize. Yeah, so keeping COVID out of Derryfield School it's a challenge. And Derryfield cannot be the only person on the team here because there's a lot of hours in an individual's day and in the life of a family that does not directly match up with Derryfield School. So we're still asking for parents to treat this as a team sport of prevention, to make risk-based decisions as you're going out, consider the impact to the community if there is an exposure, and maybe limit some of those riskier things like eating indoors at restaurants, going out to large crowded events indoors, because it's really, one exposure can affect a few people. This year's quarantine guidelines are slightly different, but really we want to rely on the great success we had last year. And after all was said and done, to see only a few positive tests and 0 in-school transmission, it was a huge testament in an unvaccinated population to what the parents, to what the family members, to what everybody was doing to keep the school safe. And so as we look back on what happened last year, as we consider how our vaccines are working with us or how the vaccines are working in the community, just keep in mind that keeping the Derryfield School doors open for education for everyone is the #1 priority.
So I just want to take this moment again to thank our student leaders who were so instrumental in helping us to stay open all last year, and our students who were phenomenal partners in working with the school, and then our parents who were just tremendous in supporting the faculty and staff in our work. And again, I think we just want to, just sort of will be cost benefit analysis, how safe is this situation? So moving forward, for grades 7 through 12, which would be the vaccine eligible grades, In those grades, we'll have all those health guidelines that we talked about at the beginning of this presentation. And then the same thing, students can choose their masks, their own 2-ply or higher masks. However, as we think about the value in an academic setting or in some program settings, in selected student experiences amongst that vaccine eligible 7th through 12th grade, there will be a mask optional situation. So for example, if you're in a classroom, if you're in study hall, if you're in a seated academic setting, we know that those are places where students and teachers are working to collaborate and communicate and connect and are going to work to be 3-foot distanced. And so in those situations, masks will be optional. If we're working closely together, like on a robot or on a lab, masks will be required. But we will be, again, Mike used the term surgical. We're going to be thinking more specifically about how we deploy our masks. In a supervised indoor athletics program, such as a strength and conditioning class, masks would be optional in that situation. But again, if you're working out right next to someone or you're spotting a weight, we would ask that you would put masks on in that situation. It's wonderful that this year students are going to be able to share materials in art class. That makes such a difference. And be able to work in groups, in labs with robots, much more like our traditional, I should say, our really innovative Derryfield teaching methodology will be back. Lunch also is going to be, with the exception, again, the 6th graders are their own little universe until they're vaccine eligible. But for everyone else, middle schoolers will be back dining in the Makinich room. Upper schoolers will have a choice of dining in the cafeteria, outdoors, in classrooms, or the makerspace. Masks will be optional outdoors. Visitors will be permitted this year, which is wonderful. We will be masked indoors. We're going to have outdoor events with Derryfield parents and family members, which is wonderful. And it will be masked optional outdoors. Our indoor events for Derryfield parents and family members, the mask policy will be determined by the actual event. So maybe if you're in a one-on-one small meeting with one other Derryfield faculty member, that would be more like a classroom situation. Whereas if it's a huge event like Parents' Night, we will probably be masked. However, things could always improve, couldn't they, Mike? The number of cases, okay, it might go up significantly. And if it went up, then we would potentially revert to universal masking in all settings, indoors only. However, it's also possible that likely that the number of cases will eventually go down. And in that situation, Mike, what are some of the health layers that we will be able to drop or change?
Great question. So the first things that would come to mind would be removing that universal masking policy. So if you went from yellow to light green, that masking policy goes away. If you go from light green to dark green, you start peeling back on those daily health attestations through Magnus. And so really it's about dialing back those prevention measures based on the risk of the community, but also leveraging that buffer that the vaccine population is providing within the walls of Derryfield School.
Excellent. So won't that be great when we're peeling things back, which I know will happen this year. I have great hope. So a thing that has changed, or an element that's changed from last year on the state level, has to do with the contact tracing guidelines and the quarantine guidelines. Mike, I've lost the slide, but could you describe that to us?
I can. Let me try to share my screen because I'm a visual person, and I'm sure there's somebody else out there like me.
Thank you.
Awesome. All right. So if you are symptomatic, like we said earlier, just stay home, get tested, feel better, get evaluated by a doctor. If you test positive for COVID, whether you're vaccinated or unvaccinated, please stay home. It's critical that you don't bring that positivity in. Although you may be vaccinated, what we've seen with the Delta virus, the Delta variant of the COVID virus, is kind of twofold. One, it doesn't provide as good of a buffer against Delta as it did with previous variants in the original COVID. But two, even vaccinated individuals are able to pass on the infection. So what we're seeing is about 1,000-time increase in the amount of virus that an infected individual will shed. And that's regardless of vaccine status. So both vaccinated and unvaccinated people who are infected have the same ability to transmit the disease to others. So no matter what, if you test positive, you stay home. So the only state definition for quarantine is somebody who's unvaccinated and has a positive, COVID positive person within their household. And so that's the critical definition here. If you are vaccinated and somebody is positive within your household, you still have to monitor for signs and symptoms. You still have to potentially wear a mask while you're in the school. But we want to make sure that the ones most at risk of developing an infection, so those unvaccinated individuals, stay home for 14 days. If you are unvaccinated, if you're vaccinated and there's a community exposure, say somebody did have COVID in the school and they sat within a seat of you, you may be notified that you had a potential community exposure, but that does not limit your ability to come in. So you'll still come in if you are vaccinated or unvaccinated in that situation, because that community exposure, because of the time duration, because of the higher likelihood of developing COVID with a family contact, what they're trying to do is keep as many students in seats as possible. So you'll wear a mask. You're going to monitor for signs and symptoms for a full 14 days. And you're going to keep that mask on until you have a negative PCR test around day 7. So vaccinated, unvaccinated will test on day 7. The mask can come off after that negative test, but you will be required to keep checking your health status for 14 full days. So if something does change, you can immediately get seen by a doc, you can get tested, and you can see if you just waited a little longer to develop that disease. Contact tracing, it's going to be done by Nurse Shaughnessy. So Lainey's going to be doing a lot of good work. And so if there's anything going on, if there's a positive test, just communicate. That's the biggest piece, and that's what's going to help reduce risk in the school, is constant and effective communication. Derryfield's going to communicate with you if there's a positive in the school. We would hope that you would communicate with Derryfield as well, and just make sure that everybody's all on the same page, so that if contact tracing does have to happen, we can identify those community exposures and we can get people to stay in class, but we can identify who needs to wear a mask while they're there.
And Lainey our nurse will also walk you through what to do. So don't worry about remembering all of this. That's one of the things that she'll really help guide us on. So, so finally, do you want to stop sharing there, Mike? We're going to move to questions. So one question that came in is, what is the risk for a vaccinated student who has a family member at home with health concerns?
Absolutely. So that's always a consideration as we look at these mask requirements. So a mask is very, very, very good at providing protection from somebody who's infected. I'm pointing at myself, I'm not infected, but somebody who's infected from spreading that disease. And remember that COVID, when you're sitting down and you're just breathing, it's not a if or, right? Like it's not a one or the other situation. There's always a potential for an aerosol. What we see is that the potential for aerosols increases as you're doing heavy breathing. And so masks are very good at stopping large particles, so those droplets. So when you're sitting at a table, if you're sitting in a classroom, masks are pretty darn effective at stopping those large virus-laden particles from getting away from your body. They also provide layers of protection from those particles entering, as long as your mask is well-fitting, so around the nose, to the cheeks, and then under the chin. Because that fabric can stop some of those particles from coming in, those larger droplets. And because of the risk of the situation, and knowing that when you're seated at a desk during a day, the vast proportion of an exposure would be from droplets, not from aerosols. That's the reason for the mask optional. And so wearing a mask will absolutely protect you from those droplet exposures. So if you feel as if somebody is in your house that's susceptible to COVID or potentially at a higher risk for adverse outcomes from a COVID exposure, absolutely it is appropriate to wear a mask. There's no stigma whether you wear a mask or not. So the mask can absolutely help. And if there's significant concerns, work with Nurse Shaughnessy, work with Lainey. If you need a little extra distance, they can probably accommodate. If you need a little extra time, they can probably accommodate. So just communicate. Anything that's going on that you are not comfortable with, and the folks over at Derryfield are going to do their best to make sure it's as safe as possible for you and for your family members at home.
Excellent. So some more questions that have come in. Lunch, will there be a variety of choices? I believe there will be a prepared lunch choice and grab and go at least, but I'm not as clear on the details about lunch. So more to come on the lunch front. If surface transmission is low, is daily disinfection for preventing COVID or just for general cleanliness? That's a really good question. Mike would say we should be doing this all the time anyway, right, Mike?
Yeah, absolutely. So daily disinfection is mostly for COVID because that 1 in 10,000 chance increases the more times people touch a surface. Obviously, you're getting more toward 10,000 as people start touching stuff. But it's not a significant risk. So disinfecting just eliminates one piece of the puzzle. Although it's not as significant as droplets, it's not as significant as aerosols, it is still a possibility. And so keeping things clean should be the new standard. And making sure that they're clean and that if there's a high touch surface, it's going to get disinfected more than once a day. Really what that once a day piece is for like desks. It's for your items that you might be using in an art class. Just making sure that you can clean them and disinfect them. For high touch items, it's probably going to be more like 2 or 3 times a day, just to eliminate that as a route of exposure.
Will 7th and 8th graders be masked? Will they be mixing cohorts? So we are treating the grades 7 to 12, the vaccine eligible population, with the same guidelines, which is universal masking with a few exceptions. And those exceptions are in seated academic situations and spaces, in programs like a strength and conditioning class, or a coached team in the gym where there's a real programmatic reason to have a little bit of a greater risk factor there, but if the risk is low because we're working at all the other elements. Will they be mixing cohorts? Yes. And in fact, the 7th and 8th graders will be mixing amongst 7th and 8th graders and amongst all the students in their class. The 6th graders, though, will mix at least amongst all the 6th graders, which is better than last fall for sure. What will the dress code be this year? The dress code returns to the dress code that we had before COVID in 2019-20 with, I think, 1 or 2 adjustments, but that is in the all school handbook. So if you want to check that, check your all school handbook, which is online through MSA, easy to find. Oh, my source in communications is saying the updated one is not ready yet, but will be ready by next week. Okay. So hold that shopping thought. It's not that dramatically different. If you go back to 2019-20, it's fairly similar.
There's an announcement in Nuts and Bolts about the revisions.
There's an announcement in the Nuts and Bolts newsletter about the revisions to the dress code, so that there's another source. Will school pictures be on the first day of school? That is a great question. Is that true? Yes, it will be on the first day of school. I'm learning things as well from this fireside chat. If a vaccinated student travels outside New England, will they be required to stay home for 10 days? That is no, correct, Mike? Because the state of New Hampshire travel guidelines changed. Could you comment on that?
Yeah, absolutely. So we're going to continue to follow the state of New Hampshire travel guidelines. And right now, there's no need to quarantine. You should still monitor for signs and symptoms. The CDC has even said during domestic travel to get a test like 3 to 5 days after your travel, just to be sure. But it depends on the route of travel. But if you can control what you can control, so distance and wearing a mask and staying away from unmasked individuals in airports, if there are any, there's national mask mandates, so it's tough to see unmasked people unless they're in a restaurant. But just identifying where the risk situations are and making those health-based decisions will do a lot to reduce that risk of bringing something back.
Excellent. If a child is isolating, quarantining at home, will there be a virtual learning option? Well, first, that happened to just a handful of students last year, and that was before vaccines. So I don't expect that will be a huge issue. However, and because the quarantine rules have so dramatically shifted, that even will reduce it even further. But there will not be a designed for virtual learning option, meaning last year, our faculty, if you can imagine this kind of superhuman feat, were attempting to design active lessons that would work for the students in the classroom in front of them, potentially in a satellite classroom connected by technology, and then for the students who were virtual as well. And what that did inadvertently is it sort of froze class, right? Because if you're virtual from far away, you can't really be part of a class where people are moving to different stations, jumping up and writing on the board, doing much active learning. I was in a class that I observed at the end of the year, which was a wonderful class in the middle school science, where we went down and we're collecting samples and observing in the incredible 90 acres of land behind the school. Can't really do that in a lesson designed for virtual students. That being said, there will be a listening in option, so that if what's happening in class works, maybe it's a discussion or a lecture or a presentation, that students will be able to listen in to that class virtually. And then the teacher will be working with that student and the advisor working with that student to keep them caught up around the other aspects of class. What is the downside of mandating vaccines other than certain exceptions? That's a good question. Generally, I like to lead by attracting and not mandating, and it has served us very well. We knew in the spring, actually, we thought we could have even had a lower vaccine rate because the number of cases was so low. We didn't need 100% vaccine adoption in order to create a safe school. And so rather than remove families' choices, we made we went this route. Mike, do you want to comment on vaccine mandates also? Do you have any thoughts on that?
Yeah, absolutely. So most academic institutions want people to express their personal opinions so that everybody can listen and everybody can grow. And if you mandate something, you kind of cut off one of those conversations. And so leaving that choice out there, because vaccines are absolutely a personal choice. It's a risk-based decision based on what we know about vaccines versus what we know about COVID. And sometimes the risk of a vaccine, when you're in a low case rate scenario, can outweigh the risk of a COVID infection. And what we've seen with a lot of the schools that we've worked with is that if you go to a vaccine mandate, there's always an exception. You can always find a doctor to write a note. And so it's kind of counterproductive, and it spends a lot of time on both sides of the house. One of the worst things that I've seen about vaccine mandates is, and I was talking with an individual in Vermont at a conference. Well, he wasn't at the conference, he was at a restaurant. And we were sitting outdoor and just, having a chat about vaccines. And he said that he was able to buy a vaccine card for $10 and he's not vaccinated. And if we can avoid the potential for a black market situation that puts more people at risk, at least with a non-mandate. We know who's done a vaccination series and we know who hasn't, and we can help control that risk. If we assume that with a mandate, every card is perfect and it's not, then it's an unknown risk, and we accept a little bit of risk in that situation. I'm not saying that you guys, that the parents at Derryfield School would not have integrity. I'm just saying that there's always somebody looking to go outside of the rules, and there's always a market where you can get whatever you are looking for.
Mike, there's a question about students traveling from outside the US. So we're so excited, for example, to have our students, our international students coming back to campus after missing them for so long. What's the current policy now about coming back to the United States?
Yeah, absolutely. And great question. So if you are traveling, if you're in a foreign country and you're traveling to the United States and you are fully vaccinated with either an FDA approved or a World Health approved vaccine, you don't have to do a full quarantine. You can do a test and then you can come back. If you are not fully vaccinated, the recommendation is still to wait 7 days and get a test, or wait 10 days or wait 14 days, just to make sure that you are doing a travel related self-observation period, not a quarantine, because you can't use quarantine unless you're a household contact.
Here's a question. What does contact between unvaccinated cohort, the 6th graders, and the vaccinated cohort 7 through 12 look like? What would happen is that if the 6th graders are in a situation, say they're in an exploration class with older students, everyone in that class will be masked indoors. In sports, they're outdoors. And then if they're traveling on vans and buses, everyone is going to be masked on vans and buses anyway. So that wouldn't be a difference that way. Here's a question about Grand Friends Day and other events. So we are expecting to go forward with most of our traditional events, and Mike's helping us figure out how to do those in a safe way. No buffets, no past hors d'oeuvres, right, Mike? We got that loud and clear. But when it comes to Grand Friends Day, that one we're still figuring out the right timing for, because Grand Friends Day is different in that in order to accommodate grand friends in the classrooms, we rent for chairs and really cram people into classrooms. So we're trying to figure out what the right date, would that be better as a spring event, trying to figure that part out right now, or is there another way to do that so that we can have our grand friends but not be in that spot? And then will Derryfield require employees to be vaccinated? We are not planning to require employees to be vaccinated, but the voluntary vaccination rate in May was 93%. We think it's about 95%. Sorry, we have some new hires who we're still figuring the math out on, but that is pretty darn high. Mike, pretty high?
It's exceptionally high.
Here's a question. People want to make sure. I guess the Derryfield masks were not as popular as one might have hoped, because people want extra confirmation that they are not required. Yes, that is right. So you can express your style with your mask, but we ask that it is a 2-ply mask or higher. And no gaiters, no 1-ply masks, 2-ply masks. And we want them, what we're hoping is that they fit really well and they fit on your face really well, and that makes you feel more comfortable through your day. Any other questions coming in? Oh, goodness.
Okay.
There's a small one on the phone.
You quote the 1 to 10,000 risk from surface contact. Is that 1 10,000 cases come from contact or from touching a surface with COVID 10,000 times?
All right.
One case.
I'm going to have to read this one directly to Mike. It's a challenging one. Mike, you quote 1 in 10,000 risk from surface contact. Is that 1 to 10,000 cases? 1 in 10,000 cases come from contact, or touching a surface with COVID 10,000 times yields 1 case?
Great question. So it's hard to answer that specific of, will I get COVID if I touch this and I'm the 9,999th person? What they're really trying to get to is to say that the risk of a single object or a surface is minimal compared to the risk of being around somebody who has COVID and is not wearing a mask and is coughing. Because we know that having that defined exposure to an individual, you're going to see at least 2 people who are unvaccinated get COVID. And with the Delta variant, that number is probably closer to 5 to 6. It's highly contagious as a variant. And so what they're just trying to do is put in perspective that it's not the surface that you need to be extremely worried about. You don't need to go and sanitize your groceries. You don't need to wait 5 days to touch your mail. You can absolutely reduce that risk. And this goes back to hand hygiene. Touching a surface and then sanitizing your hands or washing with soap and water basically eliminates that 1 in 10,000 risk. So more hand hygiene is great, but the risk is definitely not going to be significant from a contaminated surface as it is from being around people that are not adhering to non-pharmaceutical interventions, so distance, mask, hand hygiene.
So a question came in, will vaccine eligible but unvaccinated students this would be students in grades 7 through 12, but unvaccinated, be required to wear masks like the vaccine ineligible students? And the answer to that is that we really sought to make policy that was an all for one for all spirit to it, and that we would not be sort of checking people's vaccination status and having different outcomes. And the reason we feel confident about that is, Mike, could you explain why we feel that's going to work out fine?
Yeah, absolutely. So the answer is no. The policy will be, when you're sitting at a desk, there's really the option of mask optional. And so mask optional assumes that anybody can put on a mask at any time if they feel more comfortable with a mask on. We're not targeting an individual to say you must be masked because you didn't do something. That's in the state of New Hampshire, and in a lot of people's eyes, that's about the equivalent of saying get a vaccine. So it's kind of like having a vaccine mandate. What I would say is that anybody can wear a mask at any time if they feel more comfortable with it. But in those defined exception policy areas, like sitting at a desk, when you're in those small groups of being watched in the wellness center, you can absolutely, whether you're vaccinated or unvaccinated, take that mask off. And what we're looking at on the science side of that, the science behind it is there's a high vaccine rate within the student population and within the staff and faculty population. And so knowing that roughly 13% of all students will be unvaccinated, there's a big buffer of protection that comes with the vaccine status. And so knowing that those students will be mixed and mingled throughout all those places, they may not have susceptible people around them. And so the need for a mask is not as great as if the vaccine adoption rate was 10% or 0% because they're vaccine ineligible. So the mandate is really to protect the ineligible folks, not the folks that have made that risk-based decision not to vaccinate.
So let's see, another comment is, the lack of a vaccination mandate doesn't square with the military requirement for full vaccination by the end of September.
Yep, there is a very big difference. And trust me, I hear this all the time as I go into my National Guard base. There is a requirement to have 100% vaccinated military people. But there's a big difference between the vaccine requirement in the military and the vaccine requirement on the civilian side. Our military members are expected to just almost sometimes within 72 hours, pack up a bag, get on a plane, and get going. And it's all about readiness to go do your job in a different place. And if you get infected with COVID and you're in a place where there's no redundancy and you're a single point of failure and you're out for 14 days, you can have a huge mission impact. And that's not the case in academic institutions. And that's not the case in most of the world in the United States outside of maybe the government. And so it is a mandate within the United States Department of Defense, but it's more focused on mission readiness than it is, and mission readiness and mission capability than it is on health and safety. And so I know that when I go onto my base, I've got about 30% of my population that is unvaccinated. And if I were to look back at all of my interactions at my base, when they said, if you're vaccinated, you don't have to wear a mask, I can tell you that all of my unvaccinated populations were not wearing a mask. It did not matter. And so knowing that people also make those decisions to not follow the rules to the T is just another reason behind it, because they absolutely put people at risk, people around them at risk for getting COVID. And when one person can stop the mission for 2 or 3 or 5 other people, that's a big impact, especially overseas, because it's so hard to get more people in, especially if your host nation requires 14 days quarantine, even if you are vaccinated.
Here's another comment. The lack of the mask mandate doesn't square with the CDC recommendations.
Absolutely. So we talked about the CDC a little bit in the beginning and how they make broad stroke recommendations. And those recommendations are supposed to satisfy the biggest risk areas. And so in my opinion, that would be your Louisianas, your Missouris, and other states, potentially Florida, where I live. But it's meant to provide guidance and backup to any school that wants to have a mask mandate. It is a recommendation and it's a consideration, but it's not a you have to. And so when you consider high vaccination rates, relatively low case rates within the state, within the community, when you look at that risk profile that the CDC put out on what level are you in? Are you dark green, light green, yellow? What do you need to start bringing back, and what do you need to start pushing forward? There is absolutely a critical threshold that would be hit right around 700 cases in a day, or in a 7-day period, where we would bring back full mask mandates for the entire population. But we're not there yet. And we can buy back a little bit of risk because of the high vaccination rates, and also what's going on with the community, knowing that in New Hampshire, there's pretty good vaccine adoption, knowing that people are doing the right thing and they're constantly thinking about COVID, and that the rates reflect that.
I also just, comment that I'm always awed by the low population in the state, that only 1.4 million people in such a large landmass is just such a striking advantage in a pandemic compared to even our neighbor Massachusetts to the south, similar size landmass, so millions more people. Let's see, what else? Any others that we've covered them? We've covered them all. Oh my goodness. Well, if you have more questions, please send them to me at mcarter@derryfield.org, or to my assistant, Dana Laviano, d.laviano@derryfield.org. And we're in frequent communication with our advisor, Mike, and we will pass them along and try to get answers back that will be in either directly to you or nuts and bolts.